Hello students, today we will start with next topic from forensic medicine. Till last lecture we have taken many poisons and we have continued with toxicology. Now today we will start with the forensic medicine. So many important topics are remaining from forensic medicine also, so we will try to cover many of them. So today from forensic medicine we will start with impotency and sterility. Again very important topic because asked repeatedly as a 5-mark short note. It is asked as a 5-mark short note, impotency and sterility. So we'll see different causes of impotency and sterility in male. What is medical legal importance and all that we'll see as we will discuss this topic. So what are the causes of impotency and sterility? You got the difference in impotency and sterility. Impotency means inability to perform the sexual function or sexual intercourse. Inability to perform sexual intercourse. And sterility, the person may be male or female will be able to perform the sexual intercourse but will not be able to conceive. You are getting the difference. So impotency is inability to perform sexual intercourse and sterility is inability, he or she will be able to perform the sexual intercourse but will not be able to produce or reproduce, will not be able to procure. So we'll see the causes of impotency and sterility in male particularly. So first is age. A boy is sterile but not impotent before puberty. You know puberty. So boy is sterile before puberty. Sterile means will not be able to reproduce but is potent. Means can perform the sexual intercourse. The boy before puberty can perform the sexual intercourse but cannot produce the or cannot reproduce. And there is no upper limit for potency or sterility in males. No upper limit of age. There is no upper limit for potency or sterility. Any male can perform the sexual intercourse and can reproduce even at the age of 80, 85, 90 like that. So there is no any age limit for upper age limit for potency or sterility in males. Then next is malformations. If there is any malformation of the genitalia, malformation like absence or non-development of penis, absence or non-development of the penis will lead to impotency. Then intersexuality, that is again something congenital because of chromosomal defects and all. So intersexuality is can also be a cause of impotency and sterility. Then certain disease condition like the disease may be local or general disease. So local or general disease. Local diseases like acute disease of penis like gonorrhea. You know gonorrhea, I think we have completed it in microbiology. So gonorrhea is a bacterial disease. Neisseria gonorrhoeae, caused by Neisseria gonorrhoeae, it can cause impotency. And syphilis is again a bacterial disease. Then large hernias like inguinal hernia extending into, that you will study in detail in third year. So inguinal hernia extending into the scrotum, that will cause mechanical compression of vas deferens and all. That will cause impotency and sterility. Then elephantiasis you might have studied it in parasitology. Elephantiasis, also called as Wuchereriasis, it is caused by Wuchereria bancrofti. Because of the mechanical presence of this Wuchereria bancrofti parasite in the testis, they will cause mechanical obstruction to the vas deferens and the testis will undergo massive swelling. The scrotum will be massively swollen because of obstructed lymphatics by Wuchereria bancrofti. Another is large hydrocele. If the patient is having hydrocele, what is hydrocele? Abnormal collection of fluid or water in the scrotum. If the hydrocele is very large, it will cause temporary impotency. When it will be treated by surgery, when it will be corrected by surgery, that impotency will also go, and patient will be able to perform the sexual intercourse and will be able to produce. That's why it is called as temporary. Then acute fevers, acute fever like malaria, typhoid, or any other viral fever, diabetes mellitus, pulmonary tuberculosis, all they will cause temporary impotency. When this disease will be treated, when the acute fever will subside, when the sugar will come down, when the pulmonary tuberculosis will be controlled or treated successfully, all these impotency and all, they will that impotency will disappear. So patient will be able to take part in the sexual intercourse. Then neurological, if there is any neurological defect, like say there is any compression of the nerve in the spinal cord or spinal canal, or any trauma to the spine where the nerve supply of the testes or nerve supply of the genitalia is lost, and that will cause permanent impotency. Sterility will also follow. Mumps is a viral infection. Mumps, testicular atrophy, and epididymitis, that is inflammation of epididymes. All these things will cause sterility. Then injuries and addiction. Certain injuries to the spinal cord. Injury to the spinal cord will cause impotency. Then chronic alcoholism, we have seen in toxicology. Like certain chronic poisons like lead and all, and also alcohol, narcotics. The person is addicted, any person is addicted to these narcotics, sedatives and all, and excessive use of the drug, they will cause impotency. Then the person will not be able to take part in the sexual intercourse. Then another thing is exposure to the X-ray, that is radiation. We have seen in toxicology also, in radiation, this repeated exposure to radiation like X-ray and all, then injury to the testis and lead poisoning, it will cause sterility. Now the other causes will be psychological, means the patient may have disgust for the act. It can happen in certain psychological disturbances. Patient is having no any physical abnormality, no any disease, as we have discussed here in the first slide. As we have discussed here, patient is not having any neurological problem, no any fever, no any chronic disease, no any infection, or no any abnormality in the genitalia, but still the patient can have impotency because of psychological causes. He can have disgust for the act particularly. Then it can be temporary or permanent, like fear of impotence. Then fear of completing the act, it can happen that the fear of completing the act, that will cause temporary impotency. Then emotional disturbances because of some stimuli from the higher centers. If the patient is under stress, if the patient is emotionally disturbed, it can cause this temporary impotency. Then sexual perversions, that we will study in its separate chapter, what are different sexual perversions are there. So these sexual perversions will also cause impotency. Disgust for the act, just I told you, that is because of the psychological condition. There can be disgust for the act. That person may not like that sexual activity or sexual performance, and it will cause impotency. Then surgeries, certain surgeries, if the patient has undergone partial amputation of the penis as a treatment of some disease of the glands, if the patient has undergone some surgery where the part of the penis has been removed as a treatment, maybe there might be some ulcers, malignant ulcers, or some disease condition causing structural changes in the glands, and if the part of the glands has been removed during surgery, it can cause permanent impotency. Vasectomy, you might have heard this term, vasectomy. What is vasectomy? Vasectomy is one of the processes of family planning. So in family planning, what we do in case of male, the vas deferens is cut, vas deferens is dissected, So what will happen? The transfer of sperm will be prevented or obstructed by that surgery, and that's why person will become sterile but not important. He will be able to take part in the sexual intercourse but will not be able to reproduce. Then injury to the ejaculatory duct. Injury to the ejaculatory ducts will also cause sterility but not impotency. That person will be able to perform the sexual intercourse but will not be able to produce the child. Then impotency and sterility in females. These any of these two can be asked as a short note. Causes of impotency and sterility in male, or causes and impotency and causes of impotency and sterility in female. Like any of these two can be asked as a 5-mark short note. So again, in case of impotency and sterility in females, age. There is no any age limit for potency. She can undergo sexual intercourse during her lifetime at any age. So there is no any age limit for potency, but important age limit is there for fertility, or what we call it as this sterility. The commonest age group, the common age group for during which the age by which the menses begin in the females, what we call it as menarche. So commencement of the fertility is indicated by commencement of menstruation. So commencement of fertility is indicated by commencement of menstruation. Means when any girl will start menstruating, maybe at the age of 10, 11, 12 or 13, it is considered that she is capable of reproduction. So commencement, she can undergo sexual intercourse at any age. There is no any lower age limit as well as upper age limit. So she can be potent, but she will become fertile. So commencement of fertility is indicated by commencement of menstruation, that is appearance of the menstrues will be indicative of her fertility. Before that period she will be potent but sterile. Then second is malformation. Either absence, these are congenital anomalies like absence of vagina or rudimentary vagina, or because of chromosomal defects there can be intersexuality. Then firm or imperforate hymen. There can be imperforate hymen. Hymen is not perforated. There is no opening in the hymen, because of which sexual intercourse cannot take place. Then adhesions of labia. There can be some inflammatory adhesions of labia. Then conical cervix. The congenital anomalies like conical cervix, absence of uterus, ovaries or fallopian tube, absence of uterus or ovaries or fallopian tube. So congenital anomaly where either uterus is absent, ovaries are absent, or fallopian tubes are absent. It will cause sterility. She will not be able to produce the child, but will not be impotent. She will be potent. So the clinical congenital anomalies like conical cervix, absence of uterus, ovaries or fallopian tubes, they will cause sterility. She will not be able to produce the child but not impotency. Then just as we have discussed in males, here also there will be local or general diseases. The local diseases will not cause impotency if the vagina is normal. If the vagina, the lumen, or the what we call that if the vaginal orifice is normal, her lumen of the vagina is normal, she will be able to take part in the sexual intercourse but will cause sterility. So local or general diseases, they do not cause impotence if the vagina is normal, but temporary impotency can be there due to vaginismus during coitus. So at the time, maybe because of fear, disgust for the act, as we have seen in male, either because of some emotional disturbances or fear about the act of sexual intercourse, there can be vaginismus. Vaginismus is spasm of the vagina. So vagina will undergo spasm and will not allow the penis to enter, and that will cause temporary sterility. That will cause temporary impotence. So temporary impotence will be because of vaginismus, that is generally or commonly because of some emotional or psychological disturbances. Then loss of ovaries by disease or operation. It can happen that there can be some abnormality, there can be some abnormal condition or disease condition in the ovary, like any tumor of the ovary that can be benign or malignant, where the ovary has been removed by surgery. If the ovary has been removed by surgery, she will become impotent because no ovum will be discharged from the ovary, because there is no ovary. So she will become impotent, will not be able to she will become sterile, she will become sterile, will not be able to reproduce. But the removal of the ovary or removal of the uterus also, what we call it as hysterectomy for fibroid uterus or any other disease of the uterus, if the uterus has been removed or ovaries have been removed for some surgical condition, for some disease condition, she will not be able to produce the child, but she can take part in the sexual intercourse. That means she will be sterile but not impotent. Her potency will be maintained, that is, she can take part in the sexual intercourse but cannot reproduce. Then obliteration of the fallopian tubes. Obliteration of the fallopian tube, it can be surgical, or it can be deliberately done, what we call it as tubectomy. As we have seen in males, the terminal surgery for family planning is vasectomy in males, where the vas deferens is cut so that the transfer of sperms from testis to the urethra is prevented, is obstructed by breaking or by cutting the vas deferens. Just like that, if the fallopian tubes are obliterated, they may be obliterated because of some pathological condition like say fibrosis or sulfingitis, because of sulfingitis or fibrotic nodules or any other tumor compressing it from the outside. If the fallopian tubes have been obliterated, the lumen has been obliterated, the ovum and sperm cannot unite, and the lady will suffer from sterility but not impotency. And just I told you, as the vasectomy is done in males as a terminal or permanent surgery for family planning, here also in females the surgery is performed to achieve the family planning, that what we call it as terminal family planning is tubectomy, where the fallopian tubes are cut by surgery. They are cut and sutured so that, or they are ligated so that the transfer of ovum or sperm will not occur through them, and she will undergo or she will get sterility but not impotency. So cutting the fallopian tubes will cause sterility but her potency will be maintained. Then injuries and addictions, as we have discussed in males, here also there can be injury to the genitalia like lead poison, x-rays, they will cause sterility. Alcohol, long term consumption of alcohol and narcotics will cause sterility. And another is psychic causes. Psychic causes, vaginismus, just I told you, vaginismus, that is spasm of the vagina because of fear of act, disgust and emotional disturbances. So these are the causes. Another thing is operation, just I explained, tubectomy, hysterectomy, they will cause sterility but not impotency. So these are the important causes in case of sterility in males and females. Can be asked as a 5-mark short note. Now we will go to the next topic, that is artificial insemination. Artificial insemination is deposition of semen in vagina. deposition of semen in vagina or in the cervical canal or directly in the uterus by some instrument to bring about the pregnancy which is not attainable by sexual intercourse. Means in simple word, if the husband and wife are maybe because of any of these conditions as we have discussed just now in the causes of impotency in males and causes of impotency in females. So if any of these two, wife or husband or both, because of some certain anomaly, certain disease condition or any other cause, if they are not able to perform the sexual intercourse, what we do, we artificially introduce the semen into the female genital tract. It is introduced into the female genital tract so that the sperm and ovum will unite and there will be resultant pregnancy. So deposition of semen in the vagina or anywhere in the female genital tract like in the cervical canal or in the uterus by any instrument to bring about the pregnancy which is not possible by sexual intercourse because of any of the underlying cause either in the male or in the female. Got? So it is artificial insemination. So there are some legal difficulties that we will see in the next slide. There can be some legal issues regarding this procedure that we will discuss in the next part of the lecture. There are two types of artificial insemination. Artificial insemination is of two types: AIH, that is artificial insemination homologous, where the semen is collected from husband. The semen is taken from the husband and introduced into his wife's genital tract. Then another type of artificial insemination is AID, artificial insemination donor or artificial insemination heterologous, where the seminal fluid is collected from some other person than her husband. Then here the procedure is deposit the 1 ml of semen, deposit the 1 ml of semen just above the internal os by a sterile syringe at 14th day of menses. Now you know what is the importance of that 14th day. The ovulation occurs after the menses. The ovulation occurs at 14th day, so that ovum will be released from the ovary, and these sperms in the semen when they will enter on the 14th day, both of them will start traveling towards each other, towards the fallopian tube, and they will unite in the ampulla of fallopian tube and will undergo fertilization. That's why ideally it should be done at 14th day of menses, at which the ovulation generally, it can be one day earlier or late, but ideally it takes place on 14th day of menses, after menses. And the semen is collected by masturbation. Semen is collected by masturbation after 1 week's abstinence and used within 2 hours. 1 week's abstinence means if you have decided or you have convinced the couple that you will have to go for artificial insemination, they are ready, and now you want to collect the semen. So what is the condition? That male, say we will take it as a husband only, that is artificial insemination homologous. If the semen is to be collected from husband, that husband should have 1 week's abstinence. In case of donor also there has to be 1 week's abstinence, means at the time of collection of this semen by masturbation, that person should not have undergone sexual intercourse for at least for 1 week. That is called 1 week's abstinence. And the collected semen is to be used within 2 hours. If the husband is impotent, but fertile, we can go for artificial insemination homologous. That is, the semen can be collected from husband, means he is impotent, not able to take part in the sexual intercourse but fertile. The person is fertile, husband is fertile but not able to take part in the sexual intercourse. Here you can go for AIH. And what are the indications of AID? When the semen is required from some other person than husband, when the husband is sterile. The husband is sterile means he may be potent but he is sterile because of some diseases, any of the diseases as we have discussed in the causes of sterility in males. If the person is sterile or there is RH incompatibility between husband and wife, here you will have to go for artificial insemination heterologous or artificial insemination donor. Now we will see the procedure or precautions to be taken for artificial insemination. First is there has to be knowledge and written consent of both husband and wife, म्हणजे दोघाही नवरा बायकोची त्याच्यासाठी परवानगी पाहिजे. The permission should be taken from both in writing. Knowledge and written consent of both husband and wife should be taken. Then there has to be identity of both donor and recipient must not be revealed. Means if you are going for artificial insemination donor, if the semen is collected from some other person than husband, the identity of both donor and recipient must not be revealed. Means from which person you are collecting the semen, it should not be told to the woman who is receiving the semen, and also the person who is giving the semen, who is donating the semen, should not know in which woman this semen is going to be used for the pregnancy. So identity of both donor and recipient must not be revealed to each other. Now what are the conditions for donor? Donor has to be less than 40 years of age. Donor has to be less than 40 years of age, should not be in relation with husband or wife. They should not have any relation to husband or even to the wife. Should have his own children. He should have his own children, and it has been mentioned he should be resembling close to husband. They should be some closely looking with each other, resembling closely to the husband, and he must be robust mentally as well as physically. Means he should not have any mental disease, should not have any other infectious disease or any other acute or chronic disease, should not have the familiar disease like tuberculosis, diabetes, epilepsy, endocrine disorder, any mental disease like psychosis and all, should not have AIDS, very important, and syphilis. So all these investigations should be carried out before collecting the semen from the donor. So he should not have any disease like tuberculosis, diabetes, epilepsy, endocrine disorders and all, and wife of the donor must agree. So you will have to get the permission or written consent from the wife of the donor as well. And while doing the procedure, when you have collected the semen by masturbation from the donor or from the husband, the nurse should be present at the time of insemination. At the time of actual insemination, that is putting the semen into the vagina, lady attendant, that is nurse, should be present during the procedure. Then husband is accepted, even though the semen has been collected from some other person than husband is accepted as the father of the child. Therefore child is legitimate. The child is legitimate and can inherit parents' property. This is legal issue. Means if the semen has been collected from some other person than husband, then also the father of that baby will be the husband only, the husband of that woman, he has not given the semen, but he will be the father. That's why that baby will be legally of this husband and wife only, and will be able to inherit parents' property. So recipient is not guilty of adultery. It can happen that after this procedure someone can blame ki baba they had contact with each other, they had illegal relation with each other, but recipient is not guilty of adultery because there is no physical contact between that recipient woman and the donor. It has been introduced through the syringe. It has been artificially inseminated and artificially injected, introduced into the genital tract. So there is no any physical contact between the woman and the donor is also not guilty of adultery. म्हणजे त्यांच्यावर असा कुठलाही आरोप केला जाऊ शकत नाही. It is performed with the written consent. Therefore it cannot be a ground for divorce. म्हणजे असे होऊ शकतं की आर्टिफिशियल इन्सेमिनेशन नंतर नवरा बायकोमध्ये काहीतरी भांडणं झाली आणि मग नवरा तिच्यावर आरोप करू शकतो की बाबा हे मूल माझं नाही आहे, हे मूल माझं नाही आहे, तर मला हिच्यापासून घटस्फोट पाहिजे, मग मी तर काही सेक्शुअल इंटरकोर्स करू शकत नाही. मग तो डॉक्युमेंट्स प्रोड्यूस करून असं म्हणू शकतो की मी तर काही सेक्शुअल इंटरकोर्स करू शकत नाही, त्यामुळे हे मूल माझं नाही आहे, तर मला हिच्या माझ्या बायकोच्या ह्या अशा चुकीच्या वागण्यामुळे मला तिच्यापासून घटस्फोट पाहिजे, असं तो कोर्टामध्ये नंतर दावा करू शकतो. बट इट इज विथ द रिटर्न कन्सेंट, किंवा आमच्या कोणाची काहीही हरकत नाही ह्या प्रोसिजरला, असं आपण तिघांकडूनही चौघांकडूनही लिहून घेतलेलं असतं. दॅट्स वाय इट कॅनॉट बी अ ग्राउंड फॉर डिवोर्स. असा काही मुद्दा काढून असा डिवोर्स होऊ शकत नाही. Then another short topic is Testtube Baby. It is small, very short topic. Testtube Baby, you might have heard this term so many times, you might have read about this in newspaper and all. When the ovum fails to reach the uterus, the ovum that is released from the ovary, if it fails to reach the uterus, what we do? We remove the mature ovum. We remove the mature ovum from the female genital tract, fertilize it with husband's sperm in laboratory. याच्यामध्ये आर्टिफिशियल इन्सेमिनेशनमध्ये काय होते, व्हॉट हॅपन्स इन आर्टिफिशियल इन्सेमिनेशन, द ovum and sperm are allowed to fertilize with each other in the female genital tract only, that is naturally. But what we are doing in Testtube Baby, the ovum is taken out from the female genital tract, sperm is taken out from the semen of the man, and they are made to fertilize with each other in the laboratory. So the mature ovum removed from female genital tract and the husband's sperm, they are allowed to fertilize in the laboratory, and this resultant zygote, because of fertilization between this ovum and sperm in the laboratory, that zygote will be formed, and this resultant zygote is implanted in the uterine cavity. Now it can be implanted in the uterine cavity of the same woman from where that ovum has been collected, or it can be implanted in some other woman, what we call it as surrogate motherhood. So what is surrogate motherhood? Testtube baby with adaptation. So it after in vitro fertilization, after the in vitro means outside the body, the male and female gametes are allowed to fertilize with each other, and this fertilized ovum is implanted in hired uterus, भाड्याने घेतलेलं hired uterus of another woman, or another woman's ovum is fertilized with sperm of the husband. So what we are doing here, तुम्ही हे पण बऱ्याच वेळा पेपरमध्ये वगैरे असं वाचलं असेल, ऐकलं असेल, सरोगेट मदरहूड म्हणजे मे बी बिकॉज ऑफ सम डिसीज ऑर एनी ॲबनॉर्मॅलिटी, ऑर मे बी बिकॉज ऑफ सम सोशल इश्यूज. आजकाल आपण पाहतो की कॉम्पिटिशन, नोकरी आणि ह्या सगळ्या गोष्टींमुळे एखाद्या महिलेला प्रेग्नन्सी शक्य नसते, ती टाळते किंवा नको माझ्या करिअरवर परिणाम होईल वगैरे वगैरे. That's why her ovum is collected, her husband's sperm is collected, they are fertilized in the laboratory, and they are implanted in the uterus of सम अदर वुमन. तर त्या दुसऱ्या एखाद्या स्त्रीच्या युटरसमध्ये ते इम्प्लांट केलं जातं, तो झायगोट, अँड शी विल अंडरगो प्रेग्नन्सी. आणि मग ते जे काय मूल होईल ते परत तिच्या ओरिजिनल, म्हणजे ज्या दोघांनी ते नवरा बायकोनी ते स्पर्म ओम दिलेले होते त्यांना, त्यांच्या बायोलॉजिकल मदर फादरला ती बेबी परत दिली जाते. सो दॅट इज जस्ट इन सिम्पल वर्ड्स युटरस भाड्याने घेणे. सो दॅट इज कॉल्ड ॲज सरोगेट मदरहूड. सो in vitro fertilized ovum is implanted in the higher uterus of another woman, and when the baby will be delivered, it is returned to the, or it is given to the their original biological mother and father. Yes, same line last. Resultant infant is passed to its biological father and his wife. So this is about just we have seen the three important topics today. Causes of impotency and sterility in male, causes of impotency and sterility in female, then artificial insemination, and two mark questions, two small or short topics, 2 mark question, test tube baby and surrogate motherhood. So these are the important topics, any of them is always asked in the theory exam. So enough today, we'll stop here. Thank you.